Right now, you are sitting somewhere comfortable. Maybe there's a cup of coffee next to you. Maybe you glanced at your phone in the last 10 minutes. You are surrounded by convenience, softness, the quiet hum of modern life. And somewhere in France, 7,000 years ago, a man sat perfectly still while another human being cut a hole into his skull. No anesthesia, no sterile environment, no hospital, just stone tools, firelight, and another person who somehow knew exactly what they were doing. And the man lived. Not just survived the surgery, lived for years afterward. The bone grew back, the wound healed. He walked out of that moment and kept going. The question nobody ever thinks to ask is this: how did prehistoric humans, people we casually assume were barely surviving, develop a medical procedure so sophisticated that we still perform a version of it today? For a long time, researchers assumed that prehistoric medicine was little more than superstition, herbs, rituals, maybe some basic wound treatment. The dominant narrative was that early humans were reactive, not strategic, that they responded to injury and illness with fear, not knowledge. But that assumption turned out to be wrong, very wrong. In 1865, a French archaeologist named Paul Broca, yes, the same man the brain's language region is named after, examined a skull unearthed in a burial mound in Cro-Magnon territory. The skull had a perfectly circular hole in it, roughly 50 millimeters wide. Broca noticed something that stopped him cold. The bone around the edge of that hole had begun to regrow, which meant the patient had not died on the table. They had healed. They had continued living with an open window in their skull, and their body had accepted it. Broca called the procedure trepanation, and that single skull cracked open a question that still haunts researchers today. How far back does this go, and why were they doing it? Here's what's really interesting. Trepanation is not rare in the archaeological record. It's everywhere. In 2018, researchers from UC Davis published a comprehensive analysis of ancient skulls from a 7,000-year-old burial site in Bouthier-Boulancourt, France. They found that roughly 40% of adult male skulls at this site showed signs of trepanation. 40%. That is not an accident. That is not ritual panic. That is a medical practice, systematically applied, with enough frequency that you can read it in the bones of an entire community. And the survival rates are astonishing. Studies of Neolithic-era skulls across Europe and the Americas show survival rates between 60 and 90%, depending on location and technique. Think about that. These surgeons, and yes, that word is accurate, were achieving survival rates that European hospitals didn't consistently match until the late 1800s, with stone, before writing existed, before anyone had named a single bone in the human body. The techniques were precise. Researchers identify 4 distinct methods: scraping, grooving, boring and cutting, and intersecting cuts. The choice of method changed based on skull thickness, patient age, and the location of the hole. These weren't random acts. Someone studied this. Someone passed it down. But here's what nobody talks about. The people performing these surgeries understood neurological function in some form.
In 2020, a team led by Dr. Raphael Kalinski at the Hebrew University of Jerusalem analyzed a Bronze Age skull found at Megiddo, Israel, dating to approximately 1550 BCE. This skull showed trepanation performed directly over a region of the brain associated with motor function. The patient had almost certainly suffered from seizures or partial paralysis. The surgery was targeted, not random, not ceremonial, targeted at a specific anatomical region for a specific clinical reason. Your body still remembers this, not the surgery, but the knowledge economy that made it possible. Humans have always watched, categorized, and transmitted information about the body. That drive to understand why something goes wrong, to intervene, to fix, that is not modern. That is not the result of universities or scientific journals. That impulse is wired into you at a level far older than civilization. This is why you still reach for something when you're in pain, why you instinctively cover a wound, why humans across every culture on Earth developed some form of medical practice independently. Your brain doesn't know hospitals exist. It only knows the ancient rule: find the cause of suffering and act on it. The 2015 journal Pain published a meta-study showing that the human response to witnessed pain activates the same neural circuits as experienced pain. You feel what you see, and feeling what others feel is what built medicine, long before anyone called it that. A 2019 study from the University of Adelaide found evidence of sophisticated pain management in prehistoric surgical contexts. Residue of plant-based compounds with analgesic properties found inside trepanned skulls from South American sites dating back 4,000 years. They weren't operating on people who were fully conscious and screaming. They had pharmacology, they had a protocol, they had something that functioned in every meaningful sense as a medical system. Think about this. You didn't invent the need to understand your own biology. You inherited it. Every time you Google a symptom, every time you trust a doctor, every time you ask someone what's wrong and try to help, you are running software written 7,000 years ago by a person kneeling in the dirt with a sharpened piece of obsidian, trying to save someone they loved. The man in France with the hole in his skull wasn't a curiosity. He was a patient. And whoever operated on him was a surgeon. They just didn't have the word for it yet. We draw a line between ourselves and prehistoric humans like it's a canyon. Civilization on one side, darkness on the other. But the evidence doesn't support that line. It never did. The line is a story we tell ourselves to feel unique, to feel arrived, to feel like history is a climb and we're finally at the top. But here's the truth. You are not at the top of anything. You are a chapter. The same chapter that person opened when they pressed a stone tool to bone and decided that understanding the body was worth the risk. If these stories make you see yourself differently, the way that surgeon saw their patient, there's more where this came from. Every week on Before Kingdoms, we find the moments prehistory left inside you. That skull in France has been sitting in a museum case for over a century. Tourists walk past it every day. Nobody stops. Nobody asks who he was, or who saved him, or what it cost. He survived. That's enough.